Hi, my name is Richard Viney. I'm a specialist from the Queen Elizabeth Hospital, and it's my privilege to do some work here with the Eve clinics as well. I'd like to talk to you today about lichen sclerosus and the implications lichen sclerosus has for women. So lichen sclerosus is a sort of a chronic inflammatory condition which is poorly understood but may have some autoimmune components in it, but causes a scaly red appearance to classically the tissues of the vulva. It can also extend around the anal verge, but can also be found in other areas, classically in the skin folds, under the arms perhaps, or in between the buttocks and the natal cleft, or in the inner thigh. But most of the time it is in the vulva, and what you tend to see is a dry, itchy, scaly change to the vulval mucosa, which then can be characterised by a slow obliteration and loss of the shape of the labia, and once a diagnosis is reached, treatment offered in the NHS setting is usually a topical high-strength steroid cream and surveillance, because of course in the female lichen sclerosus has some risk associated with it, with developing squamous vulval cancer over time. So surveillance is certainly very important, as is a definitive treatment. Now, unfortunately, in the men who can benefit from a circumcision, there isn't an easy definitive treatment in the female. What we can offer here, which isn't readily available in the NHS, is the use of a fractionated carbon dioxide laser system, which is really very effective in this setting. What it does is it tends to create a reduction in the activity of the lichen sclerosus, as well as increasing periods of remission between flare-ups, and so the need and the use of high-dose steroid cream is much, much less. Why is that an advantage? Well, the use of a high-dose steroid cream is associated with some thinning of the mucosa, which predisposes it to tearing and the secondary inflammation and infection that can come with that. So it's a very nice solution. Once we have the lichen sclerosus under control, we can then have a look at what the damage the lichen sclerosus has actually done to the contouring of the labia minora and the labia majora. For these, if need be, we can use a combination of steroid and which is injected directly into the scarring to try and loosen and release that scarring, whilst also offering ablative laser techniques to the labia on the other side to even the appearances of the labia and recapture the original symmetry and beauty of the vulva.